Good afternoon, everybody. Dr. Michael Jacobs here for our Monday afternoon Instagram chat. In response to many requests that we've had, people are concerned on COVID and fertility, vaccines, what are our present recommendations, and what should they do or think about. As we know, COVID is all around us worldwide. Over 123 million people have been infected with COVID all over the world. And some basic information. In general, half of the people affected with COVID are men, the other half are women. It seems more severe in men than in women as far as the risk of needing ICU admission or having a fatal outcome with it. And when we think of COVID having a really bad effect, obviously we always think of the people that aren't making it, and most of those are in the older age group. But if you look at people who get infected with COVID, about 29-30% of the people infected are really of reproductive age, and they vary from 22 to 40 years old, half of them being men, half of them being women. And obviously this is concerning because this is something that I need to be concerned about. So when we ask, it's a good question, and our information to date is fairly limited because COVID has only been with us for about 16 months at this point. There are lots of case reports of a few patients here, a few patients that are in the literature, but overall everything is actually very reassuring. And I guess that's the take-home message I want everybody to get to today. There are two take-home messages. One is that it probably has minimal impact on fertility and health of pregnancy and baby. And two, we recommend you get vaccinated. So those are the two take-home messages. If you look at COVID-19 from a theoretical basis, it can theoretically get into the reproductive tract of the male and female members of the couple. But does it have an adverse effect? And almost all of the data, if we break it down first in the male side, all of the data we have to date suggests that COVID does not get into seminal fluid. So this is not a sexually transmitted disease. And that's very different than the HIV virus. It's very different than Zika, where we knew you can identify sperm in seminal fluid, and this could be transmitted from one person to the next. It does not seem to be the case with COVID. It's extremely rare to be able to identify active virus in seminal fluid, and as such, we do not think it's a sexually transmitted disease. So the issue is more of respiratory droplets, and if you're not in a monogamous relationship, if you're out there dating, yes, you need to know who you're dating and all that stuff, but it's not from having relations with them, from coital relations. It's more of respiratory contact that one needs to be concerned with. The second issue in men is, does it affect sperm counts and so forth? And what's been published is limited, and those data suggest you may see, compared to an age-matched control group, some slight decreases in sperm count and motility, and in a rare patient you may find a significant effect on spermatogenesis and so forth. But in most of the cases, even the sperm counts that have been described as being decreased compared to what you would expect them to be, they're well above the necessary minimum to be able to be fertile and fertilize eggs. And there's no evidence to date that suggests that men who've been infected with COVID have an impairment of spermatogenesis to the point where they need a more aggressive management with either intrauterine insemination or IVF with ICSI to achieve pregnancy. So far, so good. A lot of the decreases that is seen are transient. They're probably more related to the febrile illness associated with the disease than anything else. But obviously, long-term follow-up is necessary. On the female side, same basic thing. You can get vertical transmission of virus, meaning from mom to baby, but there's no evidence to suggest that it causes an increased incidence of birth defects at this point. There may be some theoretical benefits of transmitting having antibody production, and even in breast milk, you can identify antibodies against the virus that may be protective for breastfeeding for the baby as well. So there may be some benefits there. So there's no evidence that it affects male fertility at this point, no evidence that it's going to impair female fertility at this point. Really the only recommendation that's been made with this, that if you're going to have a vaccine, which we highly recommend, and sometimes the vaccine can cause, the next day or two, a little bit of myalgia and malaise and a low-grade fever. If you're having a procedure done, like an IVF procedure, we recommend that it's not done within 3 days of getting vaccinated, just so that if you have a fever, we don't confuse the fever from something related to what we did rather than from the vaccine itself. So from a standpoint of, at present, when should I get pregnant? Does COVID mean I have to be afraid to get pregnant? I shouldn't get pregnant? So far, the data there is reassuring, and the best answer to the question is when it's right for you as a couple to get pregnant, or right for you as an individual who wants to cryopreserve fertility with freezing eggs. When it feels right for you and it makes sense from a medical standpoint, that's the time to proceed. There's nothing in the literature to date that suggests you should delay fertility, not get pregnant, not have a baby. From a pregnancy standpoint, you want to try and avoid getting sick when you're pregnant, just like you would any virus. When you're pregnant, you have a large baby, you have respiratory compromise because you have your this growing baby in your belly pushing up on your diaphragms, and you're not taking as deep a breath as you would normally. And if you get infected, it's just going to make it much worse. So it's real important to consider getting vaccinated. And this is the take-home message here. The recommendations of the American Society of Reproductive Medicine, the recommendations of the American College of OBGYN, the recommendations of the American Urologic Society. Everybody is in agreement that there is no evidence that taking a vaccine will have any adverse effect on your fertility presently or in the future, and it will have no adverse effect on a pregnancy if you're already pregnant. So the short answer to a complex question is that at the present time, everything is reassuring. We recommend couples considering getting pregnant to get vaccinated, preferably sooner than later. As far as we know, the vaccines are safe. There have been millions of people that have been vaccinated with these. They should have no adverse effect on fertility based on the way these vaccines are put together and how they work, and they can only have potential benefits. For those patients that are in the middle of treatment, the only caveat is we ask that you don't get vaccinated within 3 days of us doing an egg retrieval procedure, so that if you have a side effect from the vaccine, we know it's from the vaccine and not something that we've done. So that's short answer for today for the big questions. A couple of people have written in some questions during the chat. I'll try and go through them and answer them as we go here. Question: I'm going to start my IVF treatment in May. Do you recommend Pfizer vaccine 1 month before? And could it impact the quality or health of my eggs? Recommend getting vaccinated as soon as you can. The only issue, as I said, is don't get vaccinated within 3 days of an egg retrieval procedure either way, so we know if you have side effects what it's from. But please get vaccinated. Pfizer, Moderna, J&J vaccines, whichever one is your preference or available, it's there. There's no evidence at the present time that would affect eggs, basically. Next question, another good one. I froze my eggs last January. I got the Johnson & Johnson vaccine in March and was diagnosed with COVID a week ago, but had minimal side effects. Should you be concerned? No, I wouldn't be. Obviously, your eggs were gotten before you were even infected and not a problem at all. The eggs are frozen in cryo storage. There's been no cases of virus being spread in a cryopreservation tank of any virus, basically. Your eggs that we have are protected. They weren't infected at the time. If you were not active at the time we did the procedure, remember that we did do COVID screening before you started your IVF cycle and prior to the egg retrieval. So you had 2 negative tests basically prior to having the eggs retrieved. It would be extremely unusual to have been infected or infectious at the time of the egg retrieval, and certainly having COVID 3 months later doesn't affect what we already have in the freezer, nor should you be concerned with it having an adverse effect going forward with your fertility. There's no evidence that it has any effect on eggs that you're going to produce in the future, nor on implantation of embryos and so forth. Do I recommend a specific vaccine? Any vaccine you can get is the one to get. I don't think that it's a whole lot of choice yet. If you do, the issues you prefer 1 or 2. Remember, these are the first set of vaccines, and my hunch is that come next year, we all may need boosters anyway for different strains as this virus tends to mutate, similar to the flu. But please get vaccinated for your safety, for your partner's safety, and for your future child's safety. So it's short and sweet. I appreciate everybody checking in this afternoon. Lots of good questions there. And take-home message, as I said, 1, no evidence that getting COVID is going to have any long-term effect on fertility, pregnancy, and more importantly, there's no evidence that being vaccinated will have any adverse effect on your fertility. So stay safe, get vaccinated, be smart, and have a great afternoon.